Hi, it's Dr. Ruth the Pain Doc, founder of Chronic Pain Rescue. We today are honored to have a guest. She deals with something I do not deal with. Uh, I deal with pain everywhere but where she deals with, and that is oral pain. This is Dr. Valerie Mukanga. I'm going to let her introduce herself. I love the name of her practice. Anyway, Dr. Mukanga, welcome.
Thank you so much for having me today. So, I am Dr. Valerie Mukanga, and I am a general dentist. I do have a practice here in the Dallas area of Texas, and it's in Arlington to be precise, and it's called Healing Wings Dental. And so we help any patients with dental needs that they do have. We restore teeth, we treat teeth, we remove teeth that cannot be restored. So that's pretty much what we do. Yes.
Yes, very good. And I love the name of your practice. It just makes it sound so gentle, Healing Wings. That you want that. That's a perfect name. It's not what everybody thinks of when they think of the dentist. So that's
And
that is
that's what as we strive to do, is to be as gentle as we can be, being as thorough as we can be, but we really care for people to really experience healing in their health and
yeah.
even in their mind and soul.
Awesome, awesome, very good. Yeah, so it's funny because I'm grateful in that the last few years I see my dentist twice a year. He says you're good. I get
Good.
in and I leave. I love that. It was not always like that. I guess I wanted to ask what, because there's different things that can cause pain in the mouth, right? It's not just cavities. There's other things that can happen.
Right.
I don't know if you just go through the things you have to worry about your gums and your teeth, and you know, seems like a lot of bad things can happen in the mouth.
This is true. So yeah, so you do have cavities. That's what people mostly know about, and that really comes a lot, from either not brushing properly, not taking care of your teeth properly, but also from what you eat. Just eating a food that has a lot of sweets, a lot of sugar, and that's not just candies of chocolate, but even milk. For example, even milk has enough, sugar to cause cavity. Just thing that we don't really think about, because when you do think about it, it does have some level of sweetness. The even breast milk does, and so that's why you would see a lot of babies. We do see a lot of babies, even little ones that are still breastfeeding, that do have cavities. Such was the
Wow.
case of my brother. In fact, the youngest one, he had something dark on his teeth, and I didn't know what it was. I made a connection when I was in dental school, and we talk about cavity on babies. And so
Wow.
there's that. There's even sticky food. For example, even you know when you eat things like chips and things that just lingers on your teeth, that just stay there. It causes something that bacteria can actually feed on and cause bacteria. But beside cavity, you also have gum disease. So with gum disease, it's where you have bacteria causing infection on your gum. And so that's where a lot of people notice that when they brush their teeth, they are bleeding.
Mhm.
And when it leaves that, and when it becomes even more severe, it start affecting your bone, and there you start hearing about periodontitis, because just bleeding gum would be gingivitis, which is just the inflammation of your gums. But when it becomes more serious, it start affecting your bone, and the bone that supports your teeth. You start losing that, and people start having teeth that are mobile, things like that, that really hurt your body.
Mhm.
But even beyond that, many people can suffer from oral cancer. that can be detected at the dentist. That's another pain that people can go through. And
Mhm.
obviously for that, we do send them to the doctor that would be taking care of that, post,
Mhm.
having a biopsy to confirm the diagnosis.
Mhm.
Um, there are also people who experience like bruxism, meaning that they grind their teeth. And
Yeah.
so with that, the teeth become more sensitive,
Mhm.
and they start being more flattened. And
Mhm.
so, with that, it causes pain because they losing the part of the teeth which is the enamel that is more protective, and
Mhm.
now you have less enamel, and the surface or the structure which is under the enamel called dentin is more sensitive.
Mhm.
It's more sensitive, yeah. So you can start having pain that way.
Mhm.
And there's some things that we do for that, but also there are some people who do suffer from TMJ problems, or TMD, which is this ligament right here, the temporal mandibular junction. And
Mhm.
so they have, inflammation at that level for different causes. And that really causes a lot of pain. So there
Right.
are many, many things that cause, pain.
Right.
Mouth.
Right. You mentioned about babies, and I just, gosh, this was many, many years ago. You don't correct strangers because you're strangers, and I just remember this from so long ago, and I'm so sorry that I didn't say something because it was important. This baby I was in the hair salon. This baby was given a lollipop. He
Mhm.
probably was 6 months old. I thought, oh no, what are you doing? And because sugar is addictive, and people don't realize that it's more
Right.
addictive than cocaine. That and so anyway, that made me my question for you, because people give their little ones so much sugar, sodas, or even if it's not soda, it might be Kool-Aid, or they give their little ones so many things to snack on that are just not healthy. Just what are some healthy snacks people can give their babies so that their teeth are not, subjected to all this crap at such a, and even when they don't even have teeth yet, so I'm just curious what you would tell people.
So they are definitely healthy snacks. So I remember I had some of my cousin. One of my cousin, when he was little, he knew not what it was to drink water. All he drank was soda, soda, soda. The food that he ate was just bad, bad, bad. It was like a lot of chip, all processed food, and everything that you think that is not good was what he was feasting on. And so you can do fruits and vegetables. I know, like, in the US, because I'm originally from Congo, the Democratic Republic of Congo. Back home, I talk to some of my friends and I'm like, I don't remember a child saying that they don't like vegetables. It's not even a thing. But here you see, I don't know if it stems from the cartoons or whatever they watch, but you see a lot of kids not liking vegetables. But I think that if you introduce them to the diet early enough, how are they going to really know that they really don't like it,
Right.
unless maybe like they're allergic to something? And I see that in my nephew, which is my brother's son. He pretty much like he. I have never seen him eat a candy or a cookie, but he's always eating fruits. He's eating very well. He eats fruit, vegetables, and he really likes it. So it's
Mhm.
possible to do that. It's possible
Yeah.
to train a child from the beginning. For some
Right.
parents, it's difficult because we do see some parents who say they don't eat sweets at home, but when they go to grandma, when they go to grandpa, it's a different story.
Yes.
Because
Right.
they don't want to be the bad guy, or even sometimes in school, they see them process food. But with that, obviously, you can choose what you're going to give your child.
Mhm.
But as far as you're concerned, but when it comes to other, you cannot always, let them know. You cannot always, how can I say, uh, be there, to police them and make sure they give them the right thing. But what you
Right.
can do is make sure that their oral health, that you take care of their routine,
Right.
taking care of
Right.
the teeth, brushing their teeth, making sure they're floss. That
Mm-hmm.
you can do, because even if the damage has been done, it can be decreased, by taking
Mm-hmm.
proper care of your teeth.
Mm-hmm. Mm-hmm. And well, so prevention, that which is so much better, right? They People should brush. I'm learning this from my fiance. He literally brushes after every meal. I've never seen anybody do that but him. It's like, okay, I guess that's what I'm supposed to do. So, and floss once a day.
Yeah.
That's really what we should be doing.
Right. So the recommendation is to brush at least twice a day. Brushing more doesn't hurt, but
Okay.
at least twice a day, in the morning and also at night before you go to bed, because during the nighttime you have less salivary flow, so you have less saliva. And believe it or not, the saliva actually helps as far as preventing or decreasing the chance or the effectiveness of the bacteria to take hold of your teeth. So it's kind of like a quote that's there, and that helps. This is the reason why you see that some people who take a lot of medication that end up having poor salivary flow, they end up having also lots and lots of cavities.
Okay.
So yeah, so brush at least twice a day. Night is very, very important, and floss at least once a day. But you do know that, even if you do the best that you can, every 6 months at least, you want to go ahead and see a dentist so that they can, make sure that everything is in check, and also make sure that they clean your teeth properly. Because at that point, you still would have some buildup that you're
Right.
not able to take off by yourself.
Right. Now, do you advise, like, does it help to have like because I've seen these little electric brushes, especially like with kids.
Mhm.
Do you advise things like that, or just regular brushing is fine?
So regular brushing is the minimum you would do, but obviously, like electric toothbrushes, they help even more. And
Oh,
especially kids, you have some brushes that actually have a timer. Because
right.
sometimes the recommendation is to brush at least 2 minutes, when you brush.
Right.
But kids sometimes they just like go like this, and then okay, I'm done.
Yeah.
And
Yeah.
some of these brushes would actually even show you if you're putting too much pressure on the teeth, because that can damage your enamel. It can give you a timer, but it also, gives you just a better brushing. Yeah.
Okay. And just to ask this also, is a water pick better than flossing, or flossing is fine? Is there problems with flossing? Why they have a water pick? I don't use one, but I've seen them, so just
Yeah,
wondering.
so water picks really help. Flossing is very important, because the reason why you want to floss in the first place is because the bristles of your toothbrush are too thick and they don't get between your teeth. So
Mhm.
that being said, there's a lot of people, and even a lot of people do brush their teeth. When you look at them, you see that the teeth are clean. But then when you start flossing, now you start seeing, bleeding around the gum, because, and then some people try to trick the dentist. They make sure they brush really good before they come to the, the appointment. But then after that, you just look at it, but you do see the evidence of inflammation on the gum. So flossing is very important. Water pick also does help, but you still want to floss, even if you
Oh,
use even if
okay.
the water pick. The water pick does help, but you still do want to floss.
Okay. And then I also rinse, like with an oral rinse. That's you should do that as well.
Yes, that helps as well. That helps
Oh,
as well, because it can decrease the bacterial load for you,
mhm.
and it also just gives you like a fresh scent. You feel like your mouth is now fresh, but it does help. It does
Right.
help. That helps.
Right. Oh, okay. What would um what would you recommend, like what you just told us, basically with healthcare, I mean dental care. What do you want everyone to really know? Because obviously not everybody goes into medicine or dentistry. I feel like dentist is a whole nother level.
Mhm.
You must have felt a particular calling to go into that. What is it that really would like to see the population really know, you know, about what you do, what you can provide for them to help them with their teeth?
So we do feel like a lot of people take way more care of their body that they do their mouth. They don't realize that the mouth is a part of the body, and it's very important. So oftentimes people don't come for their routine checkups. They just wait for whenever they start having pain, and that's when they decide, oh, I need to make an appointment. My tooth hurts. I need to see you now. But if we were taking care of you on a regular basis, you could have all your teeth. I remember back in the days, a lot of people, when they went to the dentist, you have a cavity, we're taking the tooth out. You have something, we're taking the tooth out. We're no longer in that era. Many reasons why people don't like to come to the dentist, because they experience some traumatic event in the past, or they are fixated on something, and so the more you don't come is the worse your situation is gonna get. What you want to do is you want to select a dentist that is actually gentle, that is actually understanding, and that can manage. And even if, say for example, you have a lot of cavities, I know that, ideally we want to do the most that we can so that it helps you, because you don't have to miss work or school all the time. But if it is for somebody that's anxious, maybe you should break down the appointment, right? The doctor can break it down to where you can gain some type of trust and realize that after all, it's not that bad. So I'll say that it's very important to actually do see the dentist. Like we were talking about oral cancer, in many instances, it can be missed.
Right.
You just go to a regular doctor, it can be missed. But
Hmm.
we are looking at the mouth, and we will be able to see, oh, there's something that's there that does not belong there, and send you to get help.
Yeah.
So avoiding the dentist is not very the best thing to do. You
Right.
actually want to face your fear and get there. Some people feel like they don't have time, maybe. You even have people who have insurance and they
Hmm.
pay for the insurance, but they feel
Hmm.
like they don't have time.
Hmm.
But at the same time, if you don't create the time to take care of yourself, what's going to happen is that once something gets worse, you're going to have to make the time. So
Right.
it's because, and at that point, perhaps you're going to be losing a tooth.
Hmm.
You're going to, have some more problems. But if
Right.
you come on a routine, like on a regular basis, it's going to
Hmm.
be better for you. And like you say, like someone like you now, you go every 6 months and it's in and out. You go, you get your cleaning, and you're done.
Hmm.
Because now you know how to take care of your teeth, and you keep going to your appointments, and so you can be monitored. So
Yeah, yeah. That two root canals was too many. So I'm gonna take care of my teeth from now on. No.
at least you were able to. So some people get past that point to where it's like, I'm sorry. At this
Mm,
point, we have to remove the tooth, and it becomes so much more expensive, because when you lose a tooth, not only do you not have a tooth, and lo and behold, I mean, if it's on back teeth, thank God, maybe because nobody can really see it as far as you seeing that. But like if it's a front tooth, I know we can restore teeth, but there is nothing in the body that is as strong as teeth, even
mm-hmm,
the bones. And
mm-hmm.
so, replacing that, we will never give you something as strong as what you had,
Ah,
what God made in the first place. So
right.
you want to save what you have. Even with back teeth, when you lose them, what happens is the teeth that were opposing that area, it can start drifting
Yeah,
and messing up your bite. And so
right.
the bite is now damaged. It can cause you even to either accumulate more plaque, or, it's just a lot of things. And replacing is way more expensive than.
Then yeah, that's a good point, because it seems like they keep on pushing these implants, which sound very expensive.
Mm,
But if you could keep your own,
ex-
right? That makes much more sense. Yeah, preserve.
and we can, restore what you have lost. But if we
Right.
can get you from the earliest stage of just maintaining what you have, you're better.
Yes. Yes. Okay. Awesome. Where can people find you if they, especially they're in Dallas or in Texas, and want to come to your practice?
So, Healing Wings Dental is the name of our practice, and we are located in Arlington, Texas. The address is 4101 West Green Oaks Boulevard, suite number 317. And like I said, it was in Arlington, Texas. We can also be found on our website at healingwingsdental.com. And also on social media, we have a YouTube channel. If you type in Healing Wings Dental, you'll find us, and even on Instagram or on Facebook.
Awesome. Awesome. Well, Dr. Mukanga, thank you so much for this. It has been very informative, and I appreciate you sharing with us today. Thank you so much.
Thank you so much. You have a great day. Thank you for inviting me today. I
Oh,
appreciate it.
you're welcome. Until next time, everyone, peace and blessings.